At the time of your hospital stay, just prior to discharge for your pancreas surgery, a nurse will go over with you all of the things to look for when you go home, and activity restrictions, driving restrictions, etc. I'd just like to go over it with you one more time, since I get a lot of questions about that. The things to look for when you go home would be fever, any temperature over 38 or 100.5 degrees Fahrenheit. If you have any chills or sweats, those would be things that we would be concerned with. We would also be concerned if your incision has any drainage. Typically, any clips you would have will have already been removed, and you'll have what's called steri-strips over the incision. If you have any disruption, redness, tenderness, swelling, drainage from that incision, or even drainage from the drain site, there will have been a drain after surgery. You may go home with the drain, in which case we'll ask you to measure the drainage and keep track of it in a log. But if the drain has been removed, you may see that you have some drainage from that site, and we'll want to know about that as well. We'll want to know about the amount of drainage, the character of the drainage. Is it thick? Is it thin? What color is it? Is it watery? We'll also want to know if it has an odor to it. Same thing from drainage from the incision as well. We also want to know if you're having any problems eating. If your appetite is very poor and you're not taking enough fluid or food in, we'll want to know if you're nauseated. If you vomited, we certainly want to know about that. If you're feeling very full and it's restricting the amount of food you can eat, we'll want you to call us about that as well. We're available 24/7. At night, you'll talk to one of our on-call surgeons. During the day, you'll want to call the GI Surgery Center, and we'll have a nurse there to answer any questions. If you're really feeling poorly and you have the ability to take a pulse, that would be very helpful to tell the nurse what your pulse rate is. If you are faint or lightheaded, if you have the ability, if you're a diabetic, we would want to know what your blood sugars are doing. If you're having problems breathing, obviously that's very important. We want to know how fast you're breathing. Those would all be things we would want to see you back in the clinic as soon as possible if you're having any of these more serious symptoms. We would also ask you to not drive for the first couple of weeks after surgery. You can certainly drive in the car and you can travel, but while you're taking pain medicine after surgery and while you're still having discomfort from the surgery, it really isn't safe to be driving a motor vehicle. As far as eating, we generally will send patients who have had a pancreas surgery on a low-fat diet. That would be no fried, greasy, fatty foods. Our dietitian will go over all this with you at the time of your discharge. We would also ask that you avoid any heavy raw vegetables, as they can gas you up and cause bloating. For example, cauliflower, broccoli, cabbage, any popcorn, nuts, they also can cause digestive problems after surgery. Again, our dietitian will go over all the specifics. So the most important thing I'd like to add to what the dietitian tells you is the idea of eating more frequent small meals. Generally, after pancreas surgery, it's difficult to eat 2 or 3 large meals a day. We really ask that you eat more like 4 to 6 small meals a day, and take time between your meals to let your stomach empty. It takes a number of weeks for the digestive system to return to normal. Sometimes can even take a month or more, and small, more frequent meals is much more tolerated after these kinds of surgeries. Activity after surgery, we encourage patients to walk. It's okay to do stairs. It's okay to get out of the house and get around, but we ask that you not do any heavy lifting, bending over, lifting up anything more than about 20 to 25 pounds. We would ask that you do, for example, 2 heavy milk jugs. That would be too much. If you have any discomfort as you're doing more and more activities, that's a sign that you need to back off. Certainly get some help from family and friends wherever possible. But we do want you to be active. We want you to do more aerobic types of activities, walking. Even after a couple of weeks, patients who have an uncomplicated surgery can get on a treadmill and walk slowly, or even on a stationary bicycle, and just do low resistance activity. So we encourage you to get up, get around, to be active, but not to strain, not to lift anything too heavy. If you feel discomfort, that's the sign that you need to back off. You can take a shower. We discourage taking baths or going in a pool in the first few weeks after surgery, but certainly daily showers are encouraged to keep the incision dry. You can go in the shower, you take all the dressings off if there's any dressings on, go ahead and take the shower and then dry everything afterwards.